Hi everybody, it's Dr. John here at Heritage Regenerative Medicine. We're doing a prolotherapy session on a left shoulder. This nice lady had kindly consented for us to let us video this. So we have some shoulder instability, and I just marked out some structures here. Long head of the biceps, supraspinatus tendon, one of the four major rotator cuff muscles. She has some pain at what's called the acromioclavicular or the AC joint, where basically your collarbone meets your shoulder. And then just two spots here to get into the shoulder joint. So we've already done a session. She said the clicking and popping is gone, easier to lift the arm, and the posterior pain is gone, but the anterior pain is still there. So that makes me think some instability up front here. So basically what we're going to do is I'm going to take my needle. Susan's going to do a little cold spray for anesthetic effect, wipe, and I'm going to just do some little injections. So ma'am, are you ready?
Mm-hmm.
Okay.
Close by Teresa.
Oh, one side.
I got to do this way.
There you go. So basically we're trying to get the long head of the biceps in a little pinch. And, okay?
Mm-hmm.
Okay, a little bit right here. We're going to redirect and just kind of walk our way up. This long head of the biceps tendon actually attaches to the labrum, the cartilage in the joint, so it's a good idea to get this if it causes trouble, because this thing can fray and pop in some people. Very good. Okay, we're going to move over to here. Just up and down there if you would.
Sorry.
So prolotherapy, what are we doing? We're basically injecting a solution, an irritant solution. This is basically 50% dextrose that's been diluted down to about 17%. And we've added a substance called serapin, also another activating agent. Serapin is used for nerve pain a lot, musculoskeletal pain. It is probably the most hypoallergenic substance on the planet. I don't think anyone's ever had a problem with serapin. And then just a little saline to dilute it. And so we're causing a little inflammation. And most people think, well, that's bad, isn't it? Right there, please. Inflammation is important. Low-grade, short-term inflammation is actually how we heal. So we cause a little inflammation through the dextrose. And the physical act of doing is, mostly the dextrose. And what's going to happen, step one is your body causes more blood, swelling and a little bit of extra, what we call hyperemia, blood gets to that area. The next step we're going to see is your body makes these things called macrophages. And they're basically the garbage men. They're the ones the white blood cells that eat up the damaged tissue. Well, the body understands if I break it down and clean it up, I have to fix it. So the next step is, you okay? Mm-hmm. Coming down. This is just a labrum. This is basically getting the cartilage in the joint. A little uncomfortable. I'm sorry about that. Just want to put a little around there, a little around there. The next step, after that inflammatory phase, we have a phase called the proliferative phase, where we get a proliferation of new blood vessels, growth factors, and then these things called fibroblasts. And fibroblasts are these cells that carry the building materials, most specifically collagen. As you know, collagen is the protein that's the building block of our skin. A lot of it's in our hair, our ligaments and tendons, and our joint cartilage. So the body's job is to lay down new collagen fibers and repair stronger than what it was. So think of it as you've got broken concrete, busted concrete and bent rebar, and the body's replacing those with new rebar, new concrete, a stronger foundation. When you get that, typically, you have less pain, because the pain fibers, the fibers, the nerves in the ligaments, tendons, and the joint cartilage that are causing pain are going to tell your body, you know what, I feel good now, I'm stable, and the pain starts to go away. So think of it as a guy with a screw tightening up all these joints here. When you get less instability, you have less pain, you have a happier person. So like I said, you can see it's tolerated very well. It only takes a couple moments. In this case, we didn't need to use a lot, and people tend to do extremely well with this. So thank you very much, and we'll see you soon.